what about breathing problems in obesity and breathing problems with surgery, and what do we expect and what do we worry about? First of all, that breathing is life and death. Okay? In other words, airway and breathing are the first two things we think about when we do CPR. They're the ABCs of CPR. Airway and breathing are number 1 and 2. Every moment, every minute must be filled with this kind of normal breath or we're not here. So the question about breathing is a critically important one and one that we pay a lot of attention to. One of the things that's interesting is how well our patients do. And you've seen that when you talk to our patients. It's serious to be obese. It's serious to be heavy and put that extra weight on the lungs. It can cause a restrictive or obstructive lung disease, and that weight puts us all at significant risk. We worry when we put you to sleep. We worry when we wake you up, and we worry about the post-operative period. Pulmonary function, breathing in and out during that time period is absolutely critical, and we have to pay a lot of attention to it. Now, having said that, though, I'd like to talk to you about our results, which are nothing short of fantastic. If you have somebody with bad lungs and they are sick and in the hospital, a common treatment is to move them to the intensive care unit, where they can be aggressively monitored. They can be watched moment to moment. We have been blessed, having done thousands of cases of patients with moderate to severe pulmonary dysfunction, lung disease, where what we found is that the surgery almost instantly, almost within hours of being completed, helps begin to resolve that problem of breathing. Now, first of all, we want to tell you that the anesthetics that we use are designed to protect you from the side effects that can hurt the breathing. As you may know, anesthetics, narcotics, sedatives can all decrease your ability to breathe normally. Narcotics can depress respirations, drop oxygen, increase CO2. Pain can decrease oxygen, increase CO2, decrease your ability to breathe. Sedatives, things like Valium, anti-nausea medicines like Phenergan, can also be depressing to the central nervous system, decrease your breathing, and put you at increased risk. Now, what we've recognized is that all these things are dangerous, and we've instituted a very highly specialized anesthetic technique that tends to avoid as much pain, as much nausea, as much narcotics, and as much sedatives as possible. In fact, we use some wildly new techniques that have been shown to be supportive of respirations. Remember a minute ago we were talking about drugs like narcotics and Phenergan and things like that, which depress respirations and increase your risk. Well, there are other anesthetics which, instead of being respiratory depressants, are respiratory stimulants. And so you may be aware of an old tiny drug called ketamine. Ketamine was a drug that was used in the past and then not used very much because it had the side effect of causing confusion or nightmares or things like that. And what we found is recent research shows that low doses of ketamine stimulates respirations. Doesn't depress respirations, it stimulates respirations. It maintains the blood pressure. It causes increased cardiac function. And so we use a small dose of ketamine, and what it does is gives good anesthesia, supports respirations, and gives an excellent long-term 5 to 7 day feeling of euphoria. So it improves how you feel post-op. It's what's called a narcotic-sparing anesthetic technique. It's one of the latest new techniques using low-dose ketamine, and we love it here. And when we have patients who've had the surgery before and after the ketamine that we've used, they've all commented on how much better they feel. So it improves safety, it decreases the need for narcotics, and improves pulmonary function. The second new drug that's only a couple of years after its approval, not the old drug ketamine, there's a new drug called Precedex. And Precedex is a hot new drug initially approved in the intensive care unit for sedating patients on the ventilator. But the sedation of Precedex does not decrease respirations, it supports and stimulates respiration. So we use a combination of Precedex and ketamine to protect your lungs, to protect you from pain, to decrease the amount of narcotics and other sedatives to keep your lung function and oxygen in excellent condition. Highly specialized technique focused intensely on just protecting you and your lungs from the problem you brought up. So great question. Good.